Hi everyone, I'm Carrie Pena, broadcasting today from the Center for Positive Media. With me here in studio, Tomás León, the president of Equality Health Foundation. Tomás, thanks so much for being here.
Carrie, it's a pleasure being here with you.
Let's talk about the mission of the Equality Health Foundation, and it is really about leveling the playing field for everyone.
Absolutely. When you think about accessing health and well-being for people, for us, our vision is ensuring access to health and well-being for everyone. But we know that certain diverse, underserved populations have a lot of barriers to accessing the resources they need to achieve optimal health and well-being. So our mission is all about leveling the playing field, removing those barriers to good health and well-being, and creating an opportunity for people to achieve their highest potential for health.
And your mission is spreading nationwide. How many states are you in now?
We're in 4 states. We started here in our hometown, Phoenix, Arizona, and we're scaling our programs and initiatives throughout Texas, Tennessee, Louisiana, and we'll be starting another state in 2024.
One of the things you're doing, these massive festivals, talk about this, and I'm intrigued because you've been able to really align a lot of community partnerships. People obviously care about the cause.
The model and work that we do is a partnership collaboration model for the foundation. So we're all about bringing together public-private partners in the community to create access to health and well-being, and we do that with a bunch of partners. Nothing we do is alone. Together we can help build healthier communities and create opportunities for people to achieve optimal health in life. And so the festival model is a great way for us to bring everybody together in a community that's diverse and underserved, under-resourced, and then we create access to those resources for the local community.
What is the main mission at these festivals? I mean, the one here in Phoenix, you have upwards of 3,000 plus people who show up. You give away healthy food bags, but talk about too just the momentum and the feeling that the community is here to stand behind you. You are not walking this path alone.
The main goal is to create access to health and well-being, but we have 3 objectives. The first objective is social connection and relationships with one another. Bringing the community together, connected, building those relationships with one another, their neighbors, and other community partners. That helps add years to your life. So when you're not isolated or lonely, and you're connected and you're socially connected and building relationships, that helps improve your health and well-being. So that's the first objective. The second is making sure that the resources we bring, we educate people to connect with those resources that may not be aware of what's available in their backyard, in their neighborhood.
For instance?
Well, it's food and housing and access to a healthcare provider, which leads me to the third objective is making sure that they have access to health education and screening, preventative screening. Prevention is where we want to focus to make sure people can get healthy and stay healthy, but if they are dealing with and struggling with a chronic condition or a mental health disorder, that we identify that early and we help them figure out how to manage that condition. You know, we just want to create a better environment because where you live and your zip code shapes your health and your well-being and has a big impact. So it's not just the healthcare services that you get inside the 4 walls, which is important, and that's what we do on the private side of the company. We have Equality Health LLC, value-based, culturally competent care. On the other side, we have to address those social determinants of health, to address the root cause issues in your zip code that have a greater impact and causing our healthcare system a lot of money. I call it the hidden healthcare drivers, cost drivers in healthcare. So we have to tackle issues of food insecurity, transportation, housing, employment, education. Those are the things that are really going to make a difference in people's lives so that they can live more quality, happier, and longer lives.
Well, I appreciate the fact that you have that personal understanding. And so you're not just looking at the people you're helping as numbers. You're looking at them as human beings.
At the end of the day, it's about people, relationships, understanding what their challenges are, and then working with public-private partners, including with the residents, to come up with solutions to create a better pathway to health and well-being. And so you have to personalize it.
Tomás, thank you so much, and thanks for all the great work you're doing. A lot of information on your website, which is equalityhealthfoundation.org. Thank you very much. Appreciate you.
My pleasure.
And thanks to all of you for watching. I'm Carrie Pena.